The Prime Minister is being accused of allowing Premier Doug Ford to forge ahead with plans to privatize Ontario's public healthcare system. This comes after Ontario announced on Monday its plans to expand the number and range of surgeries being offered at for-profit clinics. NDP leader Jagmeet Singh is calling on the federal government to ban privatization as it negotiates healthcare funding with the provinces.
One of those conditions has to be straight up no privatization.
Opposition leaders at both the federal and provincial levels have been warning that Ontario's cherished public healthcare system is at risk after the Ford government announced it will be moving some low-risk procedures like cataract removals and hip and knee replacement surgeries to for-profit clinics, freeing up surgeons at hospitals for more complicated procedures.
What are Justin Trudeau's conditions then? Apparently he's fine with Doug Ford's plan to sell off our healthcare. We believe no one should have to rack up bills in order to stay healthy.
The Ford government insists Ontarians can always use their OHIP card to get the care they need, never their credit card. But there are concerns this will pull healthcare workers away from the public system into the private system, worsening an already dire staffing shortage inside hospitals. Public health experts tell us there's no easy way to protect the staff in place.
It seems to me difficult to oversee and ensure that a private company doesn't hire someone who previously worked for a public hospital. That just seems very, very difficult to enforce.
But experts say the status quo just isn't working, and a hybrid public-private healthcare system could shorten patient wait times, as seen in other countries like Germany. The problem is that strong regulatory oversight needs to be in place to ensure patients aren't facing direct financial barriers to access healthcare services, and Canada may not be ready for the sudden change.
We can learn from those jurisdictions that have fairly strong regulatory arrangements. There's sort of these vague statements that we will sort of enforce the rules and protect equity and quality, but we haven't seen the details yet on how the government intends to do that.
And experts tell us privatizing any part of the healthcare system won't fix the core issue at hand, staffing shortages.
The issues that we're facing within the public system is a private system not facing them, issues of personnel and whatnot. There's no magic. I mean, there's only so and so many professionals available.
There is no system that seems to be spared from the kind of pressures that we're facing and that we see in Ontario.
In a statement, the Office of the Federal Minister of Health tells us the Canada Health Act ensures that all Canadians have reasonable access to medically necessary insured services based on need and not the ability to pay. Our government will continue to work with provinces and territories to make sure our investments are used in the best interest of health workers and patients and in a way that respect the principles of the Canada Health Act. For City News, I'm Tina Yazdani.